Hi, this is Carol Anderson, and we're going to be going through Chapter 2 of your pharmacology book. We'll be talking about the administration of drugs. If you'll turn to page 16 in your textbook, you can follow along, which might be helpful. In preparing to administer medication, it's imperative that you review the order in which a physician or a healthcare provider has written. Those orders will contain certain parts. Obviously, it's important that you know the medication name that has been ordered. There's usually always a dosage, and it should be legible and written in the measurement, usually milligrams. The route, as you can see in these orders, there's an IV, PO, of course, by mouth, and then at which time you would administer this medication. Here in this particular slide, we have 3 different types of orders as far as the time that's to be given. The first one is stat, which means you're given immediately. The second one is PRN, which means as needed or per resident or per patient request. And then the last one is a little bit more complicated, which says it's to be given 30 minutes prior to the procedure that's to take place. And of course, this is just a single order. The first one and the last one are just single orders that are. Next, let's look at the different parts to a prescription. These have to be on every prescription that's written. The first one is the provider information. Is usually found at the top of the prescription. It's going to give information regarding the prescriber, the name, DEA number, the address, and the phone number of the person prescribing the medication. Each prescription should always have patient information and date that the prescription is written. So here is where you would have patient name, their address, date of birth, and the name and the date. Next, we'll tell you what it is that they're ordering. It's amoxicillin, which is the subscription of medicine that you're ordering. The strength is 250 milligram tablets. Sometimes the prescription will have this instruction, which says SIG, which means label it like this, basically. So often right here you would see that written SIG. This is 2 tablets by mouth 3 times a day for 7 days, and that's what would be written on the label. There will be information as far as how many dispense, and then whether or not there will be refills. And then the last part is place for the signature of the prescriber. So these are all items that have to be on a prescription when it is written and taken to the pharmacist. There are 6 rights of drug administration. The first one is you have to get the right patient. If any of these 6 rights of drug administration are incorrect, then you will have committed a drug error, drug administration error. So you have to get the right patient, the right drug, the right dose, the right route, the right time, and then the right documentation. So these are called the 6 rights of drug administration. So let's first talk about the right patient. There's different ways to ensure that you have the right patient. In the hospital, usually armbands, such as in this picture, are used. It's usually barcoded, but also there will be the patient's name, date of birth, usually a medical record number, In long-term care, such as nursing homes and assisted living facilities, pictures are used. These are actual photographs of the resident that's attached to the medication administration record and the chart, so that you can look at the picture and see if you've got the correct patient. In the community, such as in a doctor's office or a clinic setting, usually you're going to ask the patient to verify his name and birth date prior to administering medication. I'll say about the right drug. If a patient tells you, particularly if they've been on this drug before, that doesn't look like what they take, don't administer it until you verify that it is indeed the correct drug that you're giving. Always listen to a patient when they tell you that. Right dose. Medicines always come in different strengths. In the next chapter, we're going to talk a little bit more about how to do calculations to ensure that the correct dosage is given. Please be alert that milligrams and milliliters are not the same thing. So always pay attention to the way that a drug, the order is written, and the way the drug is labeled as far as strengths go. Liquid medications usually always have a somewhere on the bottle that tells you how many milligrams are in a certain amount of liquid medicine. For example, there may be 100 milligrams in 5 milliliters of medication. So that's important to know as you prepare to administer the medication. Right route, there's several different routes that medication may be administered. Topical med is like a patch or a cream that you would rub on the skin. Oftentimes that medication is absorbed systemically. Obviously an injection such as a IM or a sub-Q injection is a particular route. IV may be ordered. Sublingual is under the tongue. Then you have inhalation route where the patient actually inhales the medication. Oral obviously is when a pill or a tablet or liquid medicine is swallowed into the digestive tract. Here you see a transdermal patch, and then rectal is also a route. Please be alert to the route that is on the order, and each drug order should contain the route that the medicine is to be given. Right time. It is important that medicines be given at consistent intervals. This is done in order to maintain a therapeutic level in the blood. Always look at the physician's order to see what the interval is, whether it's every 4 hours, every 6 hours, every 8 hours, to ensure that the medication is administered correctly. The right documentation. Anytime a drug is administered, you should document immediately that was done according to wherever you're working, whatever their policy is. And it may be done electronically or on paper, but make sure that you always document that it was administered, and if it is a injection that you administer, that you document where the site was that you administered it, whether it was the left arm, right or left buttock or thigh, wherever you administered it. As I said earlier, anytime one of the 6 rights of drug administration is incorrect, you have committed a drug error. And just a quick review, the 6 rights is the right patient, the right drug, the right dose, the right route, the right time, and the right documentation. These all 6 have to be correct in order for drug administration to be accurate. What are some ways to prevent drug errors? Always confirm questionable orders with a physician. If you're unable to read the order, or if the dosage appears to be too large for what you know is typically ordered, always check with the physician to make sure that the order has been written as he wants it to be written. Dosage calculations should always be verified with someone else. If you have a question, it's often a good idea to call a pharmacy to verify it if it's a complicated calculation. When you're doing drug administration, you should always just concentrate on one task at a time. A lot of times this is how errors are made. You start to administer a drug, and then you get distracted, and you come back, and you will forget one of the 6 rights, and then you will have committed an error. As I said earlier, always listen to the patient. If the patient tells you this doesn't look like the medicine I take, or I don't take it at this time, I take it at another time, please listen and follow up with the patient's physician to ensure that the administration is done as he has ordered. Always utilize a do not use list. These are put out by the Food and Drug Administration and some other pharmaceutical agencies. These are drugs that may not be safe to use in certain populations. It's always important too, I think, before you administer any drug, that you look the drug up, particularly if you're not familiar with it, that you find out what the typical use is and if there's any implications that you need to be aware of as far as administration. So, when you're getting ready to prepare to administer a drug, always, as we've said, verify written orders, the drug label, any drug information. Drugs.com is a good resource online. Always ask the patient if they have any allergies to drugs and what they are. Make sure that the drug you're administering is not in that category of allergies. Prior to preparing the medicine, you want to make sure that you use aseptic technique. Wash those hands. Don't touch the medication that you're getting ready to administer. And when you take a cap off of a drug bottle, always put it back on as soon as you pour the medicine. When you're preparing the medication, always do it in a quiet place where there's no distractions, and only prepare one patient's medicine at a time. When you're administering drugs by the oral route, make sure that the patient is in the upright position. All oral drugs should be administered with a full glass of water. Also observe administration of the medication and make sure that it's been swallowed. Some patients will cheek the medication and spit it out, and you want to make sure that that's not happening. Other oral routes, be aware that if it's ordered sublingual or buccal, this medicine's not to be swallowed, but instead placed either under the tongue or between the gum and cheek. NG tubes, usually you're going to be dissolving the medication in water and inserting it into the gastric tube, and make sure that the NG tube is flushed before and after the administration of the medicine. You also need to verify placement before you insert it in a medication through the NG tube. Parenteral route, this is any time that anything's given with a needle. Always use standard precautions, which means you're going to wear gloves, you're going to use safety needles, and have a sharps container close by when you're getting ready to administer it. Subcutaneous route, you can only give less than 1 ml subcutaneously. Usually those sites are in the upper arms, the abdomen, upper back. Intramuscular injections, you really should not give more than 3 mLs per site. The sites include the upper arm, the hip, and the thigh. Usually you should use the Z-Track method for drugs that are irritating, And we'll kind of go over this in class. It's a method that's used to prevent the drug from seeping back up in the tract that you've created with the needle. Intravenous, of course, is when it goes directly into the vein via the peripheral or central line. It can be IV push, it can be a piggy pack, or it can be a continuous infusion. You can either have it on a pump or it can just be gravity. IV obviously is going directly into the circulatory system, so it's important that you observe for complications during administration of this route. Intradermal usually is used for sensitivity tests such as a TB skin test. It's usually done in the inner part of the forearm or the upper back as in some allergy testing. It's important that usually you create a little well when you do that. And usually it's read a couple days later. As far as skin through the drugs through the skin or mucous membranes, topical meds, as I said, it can be paste or a cream or something that you're going to rub in. Anytime you're administering any topical medication, please wear gloves, because obviously the medication's being absorbed through the skin, and if it can be absorbed through the patient's skin, it can be absorbed through your skin, and you may not need that medication. So also for infection control purposes, you must wear gloves. Transdermal is very similar to topical, except that it's delivered through an adherent patch, and it's usually released kind of continuously, and the patch is usually left on for a couple of days. Inhalation, these are usually drugs that have some effect on the lungs, either bronchodilators, mucolytics, and anti-inflammatory drugs that the patient or resident breathes in. Other routes, of course, include the eyes, ears, nose, vagina, rectal area, anus, and the urinary tract. Always, above all, remember patient safety. Medication administration is important, and it's vital that it's done in a safe and accurate manner. So take your time, think about what you're doing, and always listen to the patient. Thanks. You'll continue this chapter on Blackboard with some activities on the point, and I think there may be some videos to watch. Thanks, and I'll see you in class.